Hello, my name is Desireh, and today's session will provide some insights on pharmacists supporting patients to self-manage common ailments. I currently work as an associate for In Supply Health, an East African advisory firm, and my areas of focus in self-care are sexual and reproductive health and women's health. For the past 2 years, I have been working on increasing awareness of and access to injectable contraceptives, specifically depomedroxyprogesterone acetate for subcutaneous administration through the pharmacy channel, while creating a viable business model that brings value to community pharmacies. This has involved building the capacity of pharmacists to be able to administer injectable contraceptives, teaching clients how to self-administer injectable contraceptives, and providing the services in a safe, effective, and quality manner. This has meant understanding how community pharmacies run their businesses and finding ways to motivate them to prioritize provision of basic services such as safe spaces, counseling before method choice, and supporting clients with adherence and management of side effects. Additionally, I have been involved in demand generation activities, including the incorporation of innovations such as chatbots, using awareness creation materials, and initiating peer-to-peer marketing to encourage women who can afford to pay for contraceptives at pharmacies to do so. These activities are currently being documented through an implementation research angle that focuses not just on the outcomes of these interventions, but also on the context with which these outcomes were achieved. Pharmacists already are the go-to healthcare professionals for access to medicines and clinical advice on minor ailments. This means that pharmacists get to meet both well and ill patients in their day-to-day work, and all these are opportunities to provide support in the identification of symptoms and subsequent management of minor ailments. Some of the ways which pharmacists can play this supportive role in sexual and reproductive health include: 1. Brief advice and signposting. Brief advice involves proactively raising awareness of and assessing a person's willingness to engage in further discussion about their health. Pharmacists should be on the lookout for opportunities to provide short pieces of health advice on family planning to the people they encounter at the pharmacy and assess who might be ready to make a change for the better. While doing this, pharmacists should remember to be non-confrontational and non-judgmental. If a person shows no interest, that's fine. They may think about what you've said and come back later. On the other hand, if someone engages with you, then be ready to signpost them to where they can get more help and support. This may mean directing them to your consultation room for further conversation, or handing them information leaflets, or simply referring them to a specialist who can better handle their ailment. Secondly, counseling. Counseling is an important tool to understand the needs of a client and better tailor one's intervention to that need. For sexual and reproductive health, the balanced counseling strategy has been shown to be effective at providing all the necessary information that a client may need before they choose a particular family planning method, make an informed choice on what method they would want to use, encourage partner involvement in family planning, and promote systematic screening for other services that are important for women's health and sexual and reproductive health. The balanced counseling strategy requires practice in order to perfect, and it can be tailored to the needs of each client. Third, the medical eligibility criteria. Together with counseling, it is important that pharmacists double-check the eligibility of a client to take up a chosen method through the medical eligibility criteria wheel. This ensures that patients are placed on the most suitable method that is safe and effective for them. Now, it's important to remember that throughout this process, always dispel any myths and misconceptions that may come up, again, in a non-judgmental and a non-confrontational way. I believe it all boils down to an empathy mindset and good communication skills. In many societies, sexual health is a taboo area, and we do not want the client to have their guard up. Undoubtedly, having their guard up will be a major barrier to whatever interventions we want to initiate. Therefore, it is recommended that pharmacists use the simple yet effective techniques to reassure patients and gain their loyalty. First, always listen before you speak. This means having the patience to understand the client's pain points and needs before jumping to a preferred intervention. Here, it may be useful to repeat to them what they've said to you to confirm comprehension by both parties. Secondly, clearly explain in lay language the current situation and all the possible effective solutions to the situation at hand. This not only helps show the client that you understand their problem, but it also helps them feel and reassure them that there is a potential solution to the problem that they brought to you. Third, acceptability is paramount. Always confirm with the patient whether the proposed course of action or intervention is acceptable to them and their situation. Finally, clearly demonstrate how to self-manage the ailment, or in the case of family planning, how to self-administer the family planning method. And it is always important to check for understanding before handing over the medication to the client. Some of the diagnostic services that pharmacists can offer before providing self-injectable contraceptives include blood pressure measurements. And here, we just want to ensure that the chosen method will not exacerbate any existing heart conditions such as high blood pressure or congestive cardiac failure. Secondly, a BMI measurement. Here, we want to ensure that the chosen method does not contribute to further weight gain, considering that weight changes are a side effect of self-injectable contraceptives. Initial contact with well and ill patients, pharmacists have the opportunity to conduct a rudimentary clinical assessment and make clinical judgments on the severity of a patient's presenting symptoms. For example, for a client who presents with excessive vaginal bleeding after administering self-injectable contraceptives, pharmacists can begin by determining the severity of the bleeding. This can be done by asking simple questions and listening carefully to the answers that are provided. This can be followed by initiation of interventions for short-term relief, such as lower dose combined oral contraceptives to balance out the hormones. Also, anemia can be prevented by prescribing iron tablets and encouraging the eating of iron-rich foods. If the bleeding persists, the pharmacists can refer the client to a GP or a specialist for further care if necessary. Having experienced the negative impact on sexual and reproductive health and women's health during the COVID-19 pandemic, I believe professional development and capacity building in self-care is a must for all pharmacists. We can all promote this by 1. Advocating for more capacity building initiatives that focus on self-care within our respective national professional associations. Secondly, we can openly share our experiences in dealing with self-care patients with other pharmacists in person or on social media. And also we can piggyback on International Health Days to spread the word on the importance of promoting self-care. Third, recognizing and combating provider bias within ourselves and among our co-workers is also important in promoting professional development. Provider biases encourage stereotyping and prejudiced assumptions about the patient, and this invariably limits patient autonomy and informed choice, thus derailing self-care in women's health and sexual and reproductive health.